The common signs and symptoms of depression, primarily the most common one is persistent low mood. So that is persistent feelings of being low or feeling sad the vast majority of the time throughout the day. Then other things that can happen. People can have difficulties with sleep. For some people, that can be difficulties with getting off to sleep, for example, or waking up earlier. It can also be wanting to sleep much more than one would normally. Appetite can also be affected. More frequently, people would experience a decrease in their appetite. So they might miss a meal. They might be less prone to having snacks. They might eat smaller meals. Some people, when they're experiencing depression, might find that they have an increased appetite at particular times of the day. So they might find in the evening, for example, that they just feel the need to eat a lot more. Energy levels are also often affected, almost always with energy being low. So people might not have the energy to go out and do their normal things, going to work, doing exercise, meeting up with friends, these sorts of things. Concentration and focus can also be affected, so people can find it much harder to pay attention to a task that they're wanting to complete. Even sometimes in conversations, people can find it harder to keep their focus on the conversation with someone. They might find that they've missed a question that somebody asked them, or they might not remember what a conversation was about. The more sort of distressing symptoms that people can experience with depression, which can be really challenging and really upsetting for some people, is that sometimes people can have thoughts of not wanting to be around anymore, not wanting to be alive, or potentially wanting to harm themselves in some way. It doesn't happen for everyone with depression by any means, but it's a really important symptom that we have to think about, because we want to really make sure that people are well and safe whenever we can. The intensity of it can vary. For some people, it can just be that there are these unpleasant thoughts that just sort of sit there. For other people, the thoughts can become more intense and can lead to particular thoughts. We know that it's a sensitive topic, and if that's something we need to explore with people, we will do it as gently and hopefully in an as supportive a way as we can for everyone, just to encourage people to be open. And, we always want to work with people collaboratively to make sure that they feel safe. So in conclusion, there's a variety of different signs and symptoms, and there may well be other signs and symptoms that people experience with depression, but those are the most common.